Welcome to this presentation. It's strategies to help you prepare for the BOC exam. My name is Valerie Moody, and I currently work as the program director for the University of Montana Masters in Athletic Training program. And in preparing this presentation for you, I historically have worked with our students over the last 15 years, helping them get ready for the BOC exam. So much of the presentation material that I've put together today are things that I use in my own classroom and things that I've learned that helped our students over the course of the years as they themselves get ready for the BOC exam. So just to start, to be clear, I have no disclosures to report for the presentation, and I do not represent the Board of Certification or the BOC, and the statements and opinions in this presentation are mine and may not be the same as others. So primary objectives for this presentation today, first is just to help you understand the exam format and scoring, what resources are available to you to help prepare for the exam, what that process might look like preparing for the exam itself, and then discuss some specific test taking strategies, as well as understanding the different types of questions that are on the exam and help you develop some strategies to answering those. So you may ask yourself why we need to take the BOC exam, especially after completing rigorous programs as athletic training. And largely this is the BOC's purpose is to assess your knowledge across the 5 domains that have been identified in our practice analysis of what athletic trainers are expected to do. So this is not a means to torture you by as much as it may seem like that, but it is a necessary safety measure to ensure that you're able to provide basic patient care as an entry-level professional across the 5 domains. So the first piece I wanted to start with is just where do you start, right? So where do you look to get some information? And going to the BOC website is probably the first and one of the most important steps you can take. So understanding how to navigate that website is critical. So clicking on the candidate tabs, setting up your profile, and then realize that it's divided into 2 sections. So the steps to become certified, which will help walk you through the process to register for the exam, schedule the exam, pay your fee to take the exam. And then there's another tab that's specifically focused on exam preparation tools. And that's where we're going to spend a lot of our time today, just talking about some different resources available in this website as well as outside the website. So the first thing I always encourage students to do is download the handbook. This basically is a roadmap for you to know what the process is going to look like, and a lot of the questions that you may have regarding the exam can be found, the answers can be found in this handbook. So download that first and foremost. It's updated on a yearly basis, so make sure that you download the appropriate one based off of your testing window. The second thing that I will often have students download for them is the exam references for the year. And this is a complete list essentially of how or what references were used to develop questions and to reference the questions. And this is not something that you necessarily want to go out and buy all of these textbooks that are listed on here, but it is helpful to see what books are being used, what books you have already in your own library from your curriculum and coursework. And for me as a program director, it also helps me make decisions as to what books I'm going to use in our curriculum so that students will have these readily available as they study. The other document that I think is important to download is the style guide, which we see here. This is just part of it, but it's a short document, but it is a guide to how the questions are written. So the exam writers use the style guide to help when they are writing and developing exam questions for the certification exam. I find this really helpful for students to review, and we review this in class because it helps with just a basic understanding of what they can see in different types of questions, the abbreviations that may be used, the scoring systems, or how things may be portrayed. So oftentimes, like for example, cranial nerves will be expressed both by the cranial nerve and the Roman numeral 6, but we'll also have the actual name of the nerve right next to it. And or how, for peroneal tendon, it could also be referred to the fibularis tendon. So it just gives you a little bit more insight into what you might see in the different questions, but definitely worth just a bit of time to download and spend some time reading through it. It's 8 pages, so it's fairly short and definitely worth every minute that you spend reading it, I think. Other resources I think that are helpful for you to review are the practice analysis. So this is up on the BOC website. You can download for free, and identifies the skills within the different domains of what an entry-level athletic trainer should be able to do and be knowledgeable in. I think knowing that there are self-assessment exams on the BOC website and some sample exam questions for you to review that are free is also a good practice, just to make sure you're comfortable with the platform and what you're going to see when you actually go in on exam day. Downloading and reading through the position statements is another tool or resource that I have found quite valuable for students to use as part of their study process and preparation. And then obviously having your textbooks and course notes from your time in the program to be able to access and review during your different study sessions, just depending on what topic you're covering that day. You want to gather your study materials. There are a lot of different books out there and resources out there. These are some of them that I've pulled. And again, I'm not pushing one particular product, but just making you aware that there are quite a few study guides available to you. There's some flashcards that are out there as well. And then there are some workshops that are available. So just depending on maybe some of the things your program already incorporates, or maybe if you're looking for some other resources, then maybe this will help give you some ideas of different resources that are available. Once you've gathered your materials and kind of have everything that you want to help you prepare for the exam, I think the next step is really just creating a study plan. And for this, you need to self-assess and really get a good understanding of where you're at with your knowledge base at this point before you take the test. So again, one thing that I like to have students do is to look at the role delineation study or the practice analysis, and I will have them go through line by line and identify if they feel comfortable or if they're less comfortable with the topic or the item, and then identify where maybe some of the holes are in their knowledge that they just don't feel comfortable at all. So once they do that, then we can use that information to help identify some knowledge gaps and maybe some areas that we need to spend some more time reviewing, either in class or outside of class, in groups, small group study sessions, or just by themselves. Taking a practice test or a pre-test. So again, this is something that I will have students do on their own, and then also in class, we have done a couple of these as well. And this again gives them a good idea of maybe where they need to spend some more time studying. The other option, which we have included this year for our students, is the BOC, one of the self-assessment exams, and having them use it in the study mode, or excuse me, in the testing mode. So then it'll generate the report for each domain to tell me where they're at and how they're scoring in each domain. So it helps us better understand how we need to work with them and spend some extra time in those areas where they're scoring a little bit lower. So we use any of those, all of those, to identify knowledge gaps. Okay, and from there, we develop specific strategies to address those gaps. So we schedule different sessions or review sessions. Each one has specific topics that are covered. And so each week in the class itself, we have specific content areas that we cover. And for the students, we encourage them to also map out a timeline with specific topics that they feel less strong in, to be able to spend time outside of class working on those areas. So for your study sessions, I would encourage you to be very specific. So don't just say, I'm going to cover rehab today, or I'm going to cover evaluation today. I would try to encourage you to, I'm going to focus on lower extremity evaluation techniques, or today I'm going to review specifically thermotherapy modalities. So be as specific as possible so you have a clear goal in mind. And up to you and your preference, whether you're going to spend some time alone studying or if you prefer to study in a group setting. The other element I have students do, oftentimes for each unit, I'll develop a vocabulary list for the students, and then I'll have them review that list and highlight any words or definitions that they just don't know or aren't familiar with. And oftentimes I'll encourage them to make flashcards for those specific vocabulary words, whether it's pathologies or a special test or something like that. To the right here is just a sample study plan and timeline. And again, this is something I would encourage you to map out once you've taken your pre-assessment or pre-test or practice test and have identified your knowledge gaps. So you can build that based off of this. Study strategies. And again, this is going to be different for everybody. You obviously know yourself best and what works for you, but try to build in a distraction-free environment. So turn the phones off, get away from the TV, put yourself in an environment where you can focus for a block of time, whether that's 1 hour or 2 hours. Throughout the study process, so in the time leading up to the exam itself, obviously self-care is very important. So make sure that physically, mentally, emotionally, you're taking care of yourself so that you are going to be ready on the exam day. Again, evaluate the use of study groups. Some people do really well in this environment, others don't. And so again, you have to know what works for you in taking these exams and how historically you've done on exams in your preparation. So if you're not one that works well or gets a lot done in study groups, then maybe that's just not a strategy that's going to work for you. Textbooks, this is not something you should be going back through and reading all your textbooks again. This should be very specific. So if you're struggling with diathermy, you're just not feeling comfortable about that, then maybe you go back and review that chapter in the textbook. But I don't expect you to go back to read an entire modalities textbook to get ready for this test. And so with that, just being cognizant of time management and making sure you've got a plan for each of your study blocks and what you want to do. So is it going to be spending 30 minutes just reviewing the text on that specific content area? Is it going to be making flashcards? So again, just be clear on what your goal is for each of the study blocks that you set out to do. Strategies to reduce your test anxiety. One, prepare early. So I think this is the semester before you take your test, you should be thinking about what the plan is. So a couple months out is helpful. This is not something that we want to cram for the week before to get ready for the test. Know where your exam is located. So if it's on campus, know where the testing center is. Make sure that you arrive early. As much as possible, try to relax the night before. I know that's hard for some of us who have higher test anxiety. Try to get a good night's rest. I jokingly put this meme up here, but it's true, right? A lot of times we're staying up late trying to cram for exams and or hit a deadline, and you don't get much sleep. So typically you don't perform as well if you're not rested. Make sure you have a good meal before you head into the exam, and make sure you're dressed comfortably. And again, do not cram. I try to tell my students to not really study the day before that they're slated to take their exam. I try to get them to go for a hike or go do something outside that they enjoy. Just try not to be studying too much in the books the night before. And then most importantly, just breathe. Just take a deep breath before you head in and know bigger picture that everything is going to be just fine. So I think the other piece that's going to be helpful is just making sure you understand what's on the exam. And so this I consider the roadmap, right? So what does it consist of? What's it look like? So the exam itself has 175 scored and unscored items, including experimental that they are validating. As a test taker and a candidate, you will not know which of these are scored and not scored. So you need to do your best on every question. There are different types of questions. One is the standalone multiple choice question, which may have 4 or 5 responses. And then we have what's called the alternative items, drag and drop, multi-select, and hotspots. And we'll go through each of these. And then there's focused testlets. And these are 5-item kind of scenario-based questions that are scored independently of each other. Okay, so they may have multiple choice questions, or it may have a drag and drop. So it can have any of the different types of questions embedded within this kind of scenario-based questioning. The blueprint is out and publicly available. So this is in the handbook. So for each domain, you're going to know what percentage of these questions exist on the exam. So prevention and wellness, domain 1, about 19.8% of the questions are going to be in this area. Examination and diagnosis, 24.3%. Immediate and emergency care, 15.5%. Therapeutic interventions, 27.4%. And then healthcare administration and professional development is 13%. So again, candidate handbook, this is public information for you to know exactly what percentage of questions are going to be in each of these areas. So this is taken from the BOC website. This is a free sample exam that you can take, but I just want to make sure that you knew what the exam screen looks like. So it's going to give you have 4 hours to take the test. There will be a timer up top. If you don't like seeing that, you can hide the timer, and then you can click on it to check and see where you're at. So the sample test online that's free has 25 questions. So it tells you how many you have left, how many you've completed. For flagging questions, so if I didn't know the answer to this one, I can flag the question and then just move on and come back to it. So then at the end of the exam, when I've gone through all 175, I can go back and review my flagged questions. There's a calculator that's built in that you can click on to calculate. And then if you need to take a bathroom break, you can hit take a break and notify the exam proctor to be able to do that. Now, the last piece here is going to be submitting the exam. And we'll talk about some specific strategies before you hit this button. But this is how you turn in your exam when you are all said and done with everything. But again, this is going to be our very last step, is to hit the submit button. What to bring on exam day? Obviously, make sure you have your confirmation email from Scantron and a valid government photo ID, and making sure that the name on your confirmation email and your ID match exactly. So just make sure you check that before you go. Scoring, just a quick bit on this. There is an exam scoring and development process tab on the BOC website that you can read through, including an item analysis and what that looks like. But basically, when we look at this, the scores are reported on a scale from 200 to 800, and the pass point is 500. Okay, so the exact point value for each question is really determined by a few things: by the function of the weight that's assigned to the content category, so the domain, as well as the number of questions in that content category. And another thing to remember is that you cannot earn negative point values. So you want to think of it as you're trying to accumulate points to hit the pass point. So items that ask for multiple correct answers, like a multi-select, they're eligible for partial credit. So from a 0 to a 1, you can hit points within there. The biggest question at the end that I get is, did I pass? And when you get notification that the results are in, which is usually 2 to 4 weeks after the exam window closes, the student will log in, and then what you'll see is eligible for certification. So at that point, that means you have passed the examination, and that you need to make sure your necessary paperwork is submitted so that you become certified. So that's your CPR card and your final transcript with the degree that's posted. Candidates who are not successful on the BOC exam will receive a basic breakdown by domain of their performance compared to the reference group if you did not receive a passing score. And that will kick you back in the system to the scheduling window, or the registration and scheduling window. Testing strategies, a couple of things to keep in mind: making sure that you read the instructions. I think in high anxiety situations, we tend to try to move fast through these things. You want to make sure you're taking time reading everything carefully. Budgeting your time, again, you've got 4 hours to take the exam. Make sure you read the entire question. If you're not sure, you want to go with your first choice. Answer all the questions in the exam, even if you have to guess. And then you'll have dry erase board or scratch paper in the exam with you that's provided make sure you're using that. And so I'll give you some ideas of when this might be helpful. So when we look at multiple choice questions, there's really 4 different types of multiple choice questions. One is recall, which is your basic knowledge on basic facts or definitions. So a lot of these are going to be define, describe, or identify. And then clinical application is actually applying that to a given situation. And so a couple examples for a recall question: of the following joints, which one is distal to the shoulder? The atlantoaxial, the sternoclavicular, carpometacarpal joint, corticoclavicular, and the costochondral. So if we look through, we think about the atlantoaxial being up in the neck, sternoclavicular being on the anterior thorax, corticoclavicular also on the anterior thorax, and the costochondral being in the rib area would make the carpometacarpal the best choice in this one. Moving to the next question: an athlete's unable to flex his shoulder after a fall. Which muscle would you predict was injured? So when we think through our anatomy, so the deltoid is abduction, shoulder flexion, shoulder extension, internal and external rotation, triceps brachii. We know does shoulder extension and elbow extension. A brachialis, primarily an elbow flexor, it doesn't cross the shoulder, so we would eliminate that one. Brachioradialis, we also know does not cross the shoulder, so that's one that we can eliminate. And then teres major is going to be on the posterior side of the scapula as an extensor and adductor and internal rotator. So right now, then we can eliminate several of these choices to bring us up to the deltoid as the best choice. 2 more types: analysis and synthesis. Really just looking at comparing information or integrating information. So this is going to be compare, contrast, differentiate, or maybe design or construct or categorize a particular content area. So when we look at a sample here, an athlete reports to the athletic training room with great toe extensor weakness and paresthesias on the anterior medial shin. So we're automatically thinking what muscles are involved, and then we have neural deficits on the anterior medial shin. We need to ask ourselves what nerve is likely to be involved. Sural nerve, thinking about where that innervates, is going to be down into the foot and the posterior calf. Sciatic is going to be fairly high up on the posterior thigh and the gluteal region. Tibial nerve could be a viable option to consider. Deep peroneal nerve or fibular nerve could also be a viable option. And then a cutaneous nerve really is applying to the skin. So it's not going to have a motor component to it to create extensor weakness. So now we've narrowed it down between the 2. And if you recall that tibial nerve innervations really are on the posterior compartments of the lower leg. So whether that's the posterior or deep posterior, that brings us to our answer, the deep peroneal or deep fibular nerve. Strategies to answer multiple choice questions: toss out high and low number options, eliminate obvious incorrect responses, much like we did on that last one. Read the entire question before you answer, or rephrase the question into your own words. One strategy is even to cover up the answers before you read while you read the question, before you read the responses. If answer options are totally unfamiliar to you, that's something that you've got to question whether that's a valid option or not. And then anything that uses always or every, those are ones that we will question if they're using absolute words like that. Thinking about questions, the answer options don't necessarily grammatically fit with the STEM question. So if the question says, what's your first step to implement a conditioning program? Implement is an action verb, so you need an action answer. The answer may be between a Harvard step test and assess flexibility. The Harvard step test is purely a name of a test, whereas assess requires you to do something. It's an action step. So grammatically, that would be a better response. If you have 2 answers or responses that look alike, you can eliminate those in most situations. And then opposite answer options, it's likely that one of them would be the answer. Okay, multi-select questions. This is going to include a scenario, a question, and selection statement, typically a choose all that apply. So this is where you would use the dry erase board or the scrap paper that's provided. Oftentimes I'll write down or have students write down all of the options, and then they can work from there to be able to answer the question. Use a true statement, true false statement approach. Read each response and determine if it's true or false relative to the scenario itself. So an example for this one is you're evaluating a recreational tennis player who is pursuing a drop shot. He stepped, pivoted, and rotated on a fixed leg. As he tried to scramble to the baseline to get to the returning shot, he immediately felt pain in his knee. You have chosen to gain information about the athlete's knee injury through the use of special tests based on the injury mechanism, which special tests are indicated, and you select all that apply. So in an acute knee injury, which test would you use? So going through, you can look at the list of tests and realize that Lachman's is probably one that you want to look at. Kleiger's we know is at the ankle, so that would not be appropriate. Vera's stress test of the knee. Alga's stress test of the knee would be applicable. Fader is at the hip, so it does not apply. Patrick's also a hip muscle test or special test, would not apply. Godfrey's or the posterior sag, probably want to do. And then quadrant we know is a low back. So that can help you select the appropriate responses. Drag and drop question strategies. For this is going to have you categorize, label, or order items. So again, you want to make sure you're paying attention to the instructions for this. If there's, more options that are provided than allotted answers, make sure you identify your distractors and get rid of those right away. This is another situation, depending on the number of items in the list, you may want to use your scrap paper or your dry erase board to help you navigate this type of a question. So for this one, you have a state tournament, wrestling tournament that you're working, you've been asked to help with skin checks, and you see the following skin lesions. You're going to drag the photo of each lesion into its appropriate category. So if we look at the photo here and recognize that this is impetigo, we drag this over into the bacterial category, that impetigo is a bacterial infection. Looking at this next picture here, we see this is molluscum contagiosum. We remember that this is a viral infection. We're going to drag this over into the viral category. And this last one being ringworm or tinea corporis, we know that that's fungal. We're going to drag that over into our fungal category. Now, if you make a mistake, you can reposition your drag and drops into the appropriate category. Another type of question is the hotspot question. So this is going to ask you to label a specific location on a structure or on a photograph or illustration. So make sure you're paying attention to right and left, what view you're looking at. Is it from the front, the side, from the back? So for this one in particular, during your evaluation, you palpate the athlete's left lower leg, foot, and ankle, indicate on the photo where the base of the fifth metatarsal is. So if we look at this, this is a left leg, and we know this is the lateral side of the foot. So the base of the fifth metatarsal, you can follow that down, click the dot, okay, and there is our circle locating the landmark. Focus testlets, remember, these typically will have 5 questions that are a part of them. So there's an opening scenario, and it will carry over into each of the screens. So here's an opening scenario that we just talked about with the tennis player. And then maybe the first question is a multiple choice question or a multi-select. So you're going to select all that apply relative to that question. And then on a different screen, or the second question, you have the same scenario, but now you're going to answer a question about goniometry. Okay, and then you're going to pick the most appropriate answer for that one. So this one, again, each of these questions are scored individually, and there's 5 per focus testlet. Final tips to consider for preparation. 1, make sure you've gone through and checked that you've answered every question in the exam itself. So don't hit submit until you know you've answered everything. Again, guess, there is no penalty. Do not go back and start changing a bunch of your answers. Change your answer only if you know you've made a mistake. So I have found that students that go back and make a lot of different changes throughout the exam, because they start second guessing themselves, tend to struggle on the exam as a whole. So go with what you've marked unless you know you've made a mistake. Don't change the answer. Trust yourself and good luck. You got this.